NACDL is the association of the nation's criminal defense bar.
Good afternoon, and for those joining us for the first time, I'll say welcome to NACDL's 22nd Annual State Criminal Justice Network Conference. And if you've joined us for any of the previous sessions, I'll say welcome back. My name is Monica Reed. I have the pleasure of serving as Senior Director of Advocacy here at NACDL. And again, it gives us great pleasure to welcome you to today's conference and for today's sessions. We're glad you're able to participate and join us for this free live virtual conference where we've brought together some of the nation's leading experts on criminal justice reform to discuss a number of important state criminal justice issues. With that, I'm going to get us started with our first presenter for today's panel, which is going to be focusing on drug decriminalization efforts in Oregon. We have a great group of folks and advocates who have been working on this issue, so I'm really excited for today's discussion. But kicking off the conversation is going to be Emily Kaltenbach from Drug Policy Alliance. She serves as their Senior Director of State Advocacy and Criminal Legal System Reform, and I'll turn it over to Emily now.
Thank you so much, Monica, and good afternoon and good morning to everyone. Excited to be here, and thank you for the invitation. I'm going to share my screen, and then I know my colleagues and friends, Tera, Hurst, and Morgan Godvin. So again, it's a pleasure to be here. The Drug Policy Alliance, if you're not familiar with our organization, is the leading organization in the U.S. building or working to end the drug war, repairing its harms, and building a non-punitive and equitable response to drug possession, drug use, drug sales. We are people impacted by the drug war. We've lost loved ones from overdose. We're in recovery. We're people who use drugs, and we've experienced the harms of drug criminalization. Our sister organization, Drug Policy Action, worked with close partners and allies on the ground in Oregon to help pass Measure 110, which we'll hear about in a few minutes. And we're working on health approaches to decriminalization in various other jurisdictions around the country. I'm going to kick off our conversation just to ground us in what we mean by a health approach, focused approach to drugs, and the impacts of the drug war on various communities. And then we're going to hear from Tera and Morgan about Oregon's historic shift in treating drug possession as a health issue. So I don't think these graphs are going to be of a surprise, but since the drug war was ramped up in the 70s, the drug war practices have led to the marginalization of millions of Americans, disproportionately impacting people who are experiencing poverty and communities of color, and also failing to reduce problematic drug use, drug-related infectious disease transmission, and overdose deaths. And the U.S. imprisons more people than any other nation in the world. The drug war is responsible for the criminalization, arrest, and incarceration of millions of people, and really 60 to 80% of those incarcerations and arrests are directly linked to possession alone and not to sales. And we know that 1 in 5 individuals in our incarceration system is locked up for a drug offense. So that means that every 31 seconds, someone's arrested for a drug offense in this country. But we know that the drug war policies have criminalized, incarcerated millions of people, but the harms and impact of the drug war go far beyond the criminal legal system. And at DPA, we're really diving into uprooting the drug war from all systems and aspects of life. So it goes beyond just the criminal legal system. People and their families are really experiencing harm from the drug war without even being arrested and incarcerated. So the drug war is very much rooted and embedded in almost every aspect of daily life, whether that's housing or employment, public benefits, child welfare, and our education system. So it's not enough to simply just stop the drug arrests or get people out of prison and jails, we also need to identify and uproot drug policies across various systems. And the irony is that the drug war practices that remove people from society and restrict access to basic necessities and punish people and their families result in the very same harms that we're supposedly seeking to eliminate. So, you know, people not having a home, not making a livable wage, being food insecure, et cetera. And therefore we see increases in drug-related harms, overdose, and infectious disease.
Got a minute? Let's talk about decriminalizing drugs and investing in health services. Communities need a health approach to drugs, but the United States prioritizes criminalization as a response to drug use. Drug offenses are one of the leading causes of arrest in the U.S. People are forced into jails and prisons instead of having access to community-based services. Meanwhile, illicit drugs are more available, stronger, and cheaper than ever. Overdose death rates have risen dramatically. It's time to decriminalize drugs and invest in health services. Drug decriminalization means that people are no longer arrested or incarcerated for drugs for personal use. Instead, resources go towards needed services and supports. This includes voluntary treatment, housing, employment, harm reduction, recovery services, and peer support. Drug decriminalization does not legalize drugs. In 2020, drugs were decriminalized in Oregon. Drug possession arrests significantly decreased, and $302 million went to addiction services in just the first 2 years. The Drug Policy Alliance is advocating for decriminalizing drugs and investing in health services across the U.S. Learn more at drugpolicy.org.
So again, before we dive into Oregon, I just want to stress that decriminalizing drug possession and use is bigger than just changing criminal penalties, right? It's about addressing the compounding impacts of the drug war on everyday life, investing back into the community, and increasing funding for addiction services. It has to be the whole package. It's a health-focused approach. And now you're going to actually hear from Morgan and Tera about how that's working on the ground in Oregon. So I'm going to keep the screen up, but pass it on to Morgan. Thank you.
Our next two speakers, so Morgan Godvin, who's an internationally recognized expert on drugs in prisons, and she currently serves on Oregon's Drug Decriminalization Measure 110 Oversight and Accountability Council, the state's Alcohol and Drug Policy Commission, and Portland's Public Safety Coordinating Council. So we're glad to have Morgan, and Tera, I will introduce you shortly as well.
Thank you so much, Monica. And, left out of my introduction there, my bio, is that I am formerly incarcerated. Specifically, I was arrested in the state of Oregon in multiple different counties for felony drug possession and sent to jail many, many times. And that is how I come to this work. And today I am a researcher. Next slide, please. So Emily gave us the high level drug decriminalization, but specifically, what is Measure 110? What are the mechanisms by which it operates? So this took the quantities that were already set by the legislature. So we had defelonized in 2017. So it took those misdemeanor levels and dropped them from a misdemeanor to a Class E violation, which is a civil offense, not a legal offense. That included a maximum fine of $100, which can very easily be waived by doing a drug screening, a drug evaluation. Now, that does not mean compulsory or coercive treatment. That just means people go through the screening and are offered voluntary services that they can then engage with. The limits so it's anything less than 1 gram of heroin and also now fentanyl. 1 gram or less is that Class E violation. You can see here the thresholds for when it becomes a misdemeanor, again, on the right in that table. But it didn't just decriminalize those low-level possession amounts. So Measure 110 did two main things, right? So the table you see where we're no longer arresting people for those lower level drugs, but then it diverted the majority of our cannabis tax revenue into a fund for drug treatment services, specifically creating behavioral health resource networks, which for the rest of this call, I'm going to pronounce as BURNs. Okay, that's how you say that acronym, BURN. And it created at least one in each county. And each burn has the full spectrum of services that were funded under the measure. So we're going to see housing, low barrier treatment, peer services, supported employment, and harm reduction in every single county in the state. But what was most revolutionary about this, I feel, is that according to the measure, they had to form the Oversight and Accountability Council to determine the grant funding, to determine the priorities, steering the ship. And who is steering this ship? It is people with lived experience in the state of Oregon. About half of the council are formerly incarcerated. The council is majority Black, Indigenous, and persons of color. And the vast majority of persons on the council identify as persons with lived experience with drug use. So I saw, thank you, yeah. And I applied literally through a tweet. I saw like the Oregon Health Authority had like released an application for the Oversight and Accountability Council shortly after the measure passed. And I applied right there through Twitter on a Google form. And a couple months later, I was notified that I was being appointed to the OAC. Next slide, please. And so here is the timeline. We voted on it in November 2020. It passed. February 2021, the first part of the measure went into effect, meaning they could no longer arrest people if their drug possession were under those thresholds that you saw before. In June 2021, it was codified into our statutes by legislature with Senate Bill 755. We passed the OAC passed temporary rules for the burns in September 2021. And then we started the wonderful process of grant making in a new, never before done way, where it was the OAC reviewing the grants, then later with the support of the Oregon Health Authority. We got some money out the door really quickly with the Access to Care grants in June of 2022. It was even sooner. There were some delays with the grant making by a few months, and the money finally went out the door in September 2022. So that is a total of $300 million that was infused into Oregon's drug treatment services like that. The largest infusion into our behavioral health services ever in that amount of time. And so now we are almost a year, coming 10 months after the money has gone out the door. There was hiring issues, right? We're in a workforce shortage. Measure 110 funds were mandated to pay people a living wage. So we saw the average wage for the behavioral health workforce shoot up, but now organizations are fully staffed for the most part. And we are actually seeing the services on the ground. I see them every single day in my work. Next slide, please. So you see immediately arrests plummeted. Arrests were already down because of COVID, so it's a little bit confounding, and you can see that on this graph here. But arrests have maintained at that very low level. So there's different estimates for how many people have been spared arrest and the collateral consequences that come with an arrest at this point. I think Tera could probably give, I think it's 10,000 people now, 2 years later, have average. Have not been arrested, have not suffered the collateral consequences that I went through, have not been strip searched, told to spread their cheeks and cough because they had a residue amount of drugs in their pocket. The things that happened to me are no longer happening to other Oregonians. So right, first rule, do no harm. So that's the arrest. That's the part on the left. The second part is healing. And that is much more complicated. And so you're going to see the breakdown of our funding here. The majority of the funding went to the behavioral health resource networks, which does have that full continuum of care. And then you're also going to see the access to care grants on the pie chart on the right. Next slide, please. All right, so the Oregon Health Authority finally released this lovely dashboard that I actually kind of like because I'm a big nerd. We funded 233 community-based organizations across 42 burns in 36 counties. Some burns have multiple counties. I believe 60,000 Oregonians have received services, Tera? Is that the...
Yeah, it's complicated, but we do know how many Oregonians. I think that was meant to be taken off the slide.
Yeah, sorry. Yeah, 60,000. Some of those might be a double count. It's a little bit hard to track the data, but it is certainly in the tens of thousands of unique individuals have received Measure 110 funded services. So what that means is you do not have to have gotten a Class E violation to be eligible for services. The whole point of Measure 110 is that you do not have to pass through handcuffs or police contact to be eligible for the services that you need. Every single Oregonian is eligible for them at no cost. So there have been 5,391 citations issued to date. And I think some of the next facts I like just because they are surprising to people. The most common drug that people are being cited for is actually methamphetamine. And as Tera will talk about later, you're going to hear some opponents with certain critiques or certain narratives. And one of the concerns is that Measure 110 would attract people for drug use in the state. But when we look at the law enforcement data, the citation data, 95% of all people cited are Oregon residents, meaning they have an Oregon ID, they live in the state of Oregon, they are Oregonians. And so clearly people are not flocking to the state. That's a fairly pernicious myth that we also see in homelessness, and that report from Governor Newsom's office last month also debunked it in homelessness, showing 90% of all the homeless people that they interviewed in the state of California became homeless in the state of California, were last housed in the state of California. And so I just think that is pretty interesting that we have law enforcement data here proving that fact. And it not only diverted the cannabis tax revenue, but according to the measure, it was going to reinvest the justice savings, which was $37 million in the first biennium and $39 million in the second, for a total of $76 million that would have gone strictly to incarceration, which has been shown to not be beneficial in our fight against drug addiction or drug overdose, have now gone to health-based services, supportive services for Oregonians in need. So again, as Tera will probably talk about later, you're going to hear some pretty spurious claims being made in the media about Measure 110, and specifically associating it with petty crime or an increase of various types of crime, perceptions of public disorder. So RTI International did this research project where they compared calls to 911 over time for Sacramento, Seattle, Portland, and Boise. So those are like our, Pacific Northwest, similarly sized situated cities. And they found that there was no increase to calls for 911 after February 2021, when we stopped arresting people for drug possession. Essentially, there was the standard seasonal changes that occur, a slight uptick in the summer for all cities evaluated. But Portland did not stand out. When you look at a graph of our calls for service, you cannot tell the difference before and after drug decriminalization. We are incredibly similar, especially to Seattle. Next slide, please. And now we're going to hand it over to Tera. So Monica, do you want to introduce Tera?
I do. Thank you, Morgan. So our last speaker that we'll hear from is Tera Hurst. She serves as the Executive Director for Health Justice Recovery Alliance and has been influential in leading the efforts to implement Measure 110. So Tera, you can take it away.
Thanks. Hi, everyone. It's great to have so many folks interested in the work that we're doing here in Oregon. And more importantly, I would say able to get some more accurate information out there of what's actually happening on the ground here, because I'm sure you all have seen the media reports that, you know, Portland is a fentanyl den, and that Oregon's decriminalization has been a disaster, and all the other things that we've all heard. And just like in a lot of sensationalist spaces, we can say on the ground some of the incredible things that are happening, and also some of the challenges that we are facing. So I think it's really important to take a step back and remember that when Measure 110 passed, we were just starting to walking into a global pandemic. It was a shutdown that none of us have experienced. We were all kind of working from home, juggling, and not knowing what was going to happen, right? I remember walking into the 2021 legislative session that really, we didn't know what the economy was doing. We didn't know what the future for kind of what our needs as a state was going to be, just on the basic levels of health, being able to provide education for our kids. Just the uncertainty was real. And so here comes a ballot measure that has an extremely aggressive timeline for practical reasons, because like Morgan said, first, do no harm. We needed to make sure that no more people were getting arrested and barriers on their records for having small personal amounts of drugs on them. We also needed to make sure that we were investing in a system that Oregon has never really invested in, which is our behavioral health and especially our addiction systems. So when I first started was the day after it passed in November of 2020. You know, some of the first conversations we had were with providers on the ground, and they were saying, we are going to close our doors. We can't afford to stay open. We can't house people anymore, and we're about to make the problem even worse. Oregon at the time, and it still is, we had about the second highest rates of addiction in the country, and we were at the bottom, if not at 50th, in access to addiction services. We are worse than states that didn't take the Medicaid waiver, right? So just like painting a picture of where we started. We walked into the legislative session, we stayed on our timelines, and we really made sure when we walked in, everybody told us there's no way we can invest these funds. We don't know what's happening. We're in the middle of a global pandemic. You can't ask our Oregon Health Authority to do anything other than work on this one crisis. And we pushed back. We're going to lose even more services that we can't afford to lose. We are going to lose more lives that we can't afford to lose, and we really need your support. So we did get some early quick money out into the community in July of 2021. That really helped stop some of these critical organizations like Bridges to Change was able to keep their housing in a rural county in Wasco County open because they were about to have to close it, all the way to like folks being able to actually expand their harm reduction efforts, their overdose prevention efforts, expand housing, and help stabilize some of our community. And I think that that's an important thing to remember when we're looking back 3 years, not even 3 years later, what has happened, right? So then as Morgan had talked about, we looked at $265 million that needed to get invested right away into these community services and these community-based organizations. And although I do agree with Morgan that the first most transformational thing was getting the Oversight and Accountability Council, I think the thing that nobody is talking about that is really this quiet revolution that's happening in Oregon is we invested $265 million into local community-based providers who are meeting their community where they're at and saving lives. And we did this in a way that isn't normal, at least for the Oregon system, which is to push it through our big insurance groups, our community care organizations, or through our counties. We did this by pushing the state, and the council was pivotal in making sure this happened, getting those funds directly to our providers, saying, we trust that you know what you're doing and what your community needs most. And we prioritize providers who are led and also working with communities who've been most impacted by the war on drugs. And that is the revolution that's happening in Oregon. We have so many incredible providers on the ground right now, working with folks, going tent to tent, going, doing outreach that they've never been able to do. And the stories that we're hearing from across the state, not just Portland, but in Bend and in Medford, and, kind of reaches the whole state, is that because of the outreach that 110 is allowing them to do, and expand their housing and their detox capacity and their intensive outpatient capacity, when somebody's ready because of the outreach they've done, they are getting connected to services that day. It's not through the citation system. It's because people with lived experience are building relationships with people who are suffering and struggling, and are giving them dignity and choice and saying, I'm here when you're ready. And those folks are feeling safe to say, I'm ready. And those people are getting placed in detox. They're getting placed in housing. I'm going to a grand opening of a detox tomorrow in East Portland that is so exciting. And it wouldn't have happened if they hadn't gotten the $1.5 million that they got for 110 11 months ago. They opened a 16-bed facility in 11 months. That is unheard of. That is extremely fast and just really inspirational. So I think when we are seeing all of this, Portland's a dumpster fire. I love our city and it's not a dumpster fire. And I took my family down there over the weekend, and it's still beautiful. But also, people are suffering in our streets. There has been a huge increase in evictions. Measure 110 didn't touch evictions. There's a huge influx of, our downtown core hasn't brought their employees back. So we do have a lot of abandoned buildings by large corporations. There's a lot that is leading into this kind of swirl around Measure 110 is the reason for everything that you don't like in Oregon and nationally as well. I think that, what this slide is also telling you about is every single legislative session we've had, we've faced at least 6 to 10 bills with an outright repeal of Measure 110, with a recriminalization of for 110, and multiple attempts, and not just like fly attempts, real attempts at taking the money back, because people aren't comfortable with where the money went, because it went to the communities most harmed by the war on drugs, and it's doing the work that it needs to be doing. Are we doing enough? Absolutely not. We have not invested in the behavioral health care system here in Oregon. That is not because of Measure 110. Measure 110 is actually part of the solution and has invested a lot of money into that system. We did make a mistake on the previous slide. It's actually 39 million that came from the public safety, from the law and order side over to healthcare systems, and are investing that right back into our providers. So we heard that a lot of that money was coming from parole and probation. Those funds have now been diverted into healthcare, which is exactly what the voters voted for. I think we all understand that we are in a political environment. This is not about the policy. We're seeing too many people die of overdoses because people are still thinking of this as a moral issue and not as a healthcare issue that we should be treating as a healthcare issue. It's getting linked to literally everything from crime to homelessness and to public disorder. This is the fight, and it's an all-out assault at this point on people who are struggling and who just need access to services. I think next slide. I'm not sure if I covered all that. So lessons, there's so many lessons. I'd say first, don't go first, because that's really hard, and we're learning all the lessons right now, and it's not the most fun. That being said, because we did go first, we've learned a lot. We need to make sure that we're telling the story of 110, and it's not about it shouldn't be on the shoulders of the advocates. It really is about the state owning the issue and making sure that their constituents know what services are available, how to get a hold of them, why they're important. Help us destigmatize the fact that people who are struggling with substance use are not morally failing folks. They, a lot of them just are trying to treat untreated trauma and all of the other things that I think most people on this call understand. And we need better data, right? It's also really difficult to do this in a pandemic. So I'd say other lesson, let's not try and do big policy change during a pandemic. That being said, I wouldn't take any of it back because like Morgan said, at least 10,000 people don't have criminal records today. And at least 60,000 services within Oregon have been served to people who needed it. Period. End of story. Don't regret it. And we are in the middle of a political storm that quite frankly, I haven't seen in a really long time. And it's really difficult. We are facing real challenges to Measure 110. There is a big effort to get it back on the ballot and recriminalize folks, and not just even recriminalize them back to where it was, but actually make a more harsher and stiffer punishments. We know that in other states that, like New Mexico, that have felonized possession, their overdose death rates are even higher. So that's not a way to solve this problem. We need to figure out a better way of getting in front of folks who are concerned about this and how to really work with them. I think the other piece is the citation process. We are held to the standard of the citation process, but what people don't recognize is that it hasn't even been implemented at a state level. Each law enforcement agency is doing their own thing because they have not been given the training from the Department of Public Safety Standards and Training. They have not been connected with the services that are now in their communities, and they don't know what this handoff could look like. And that's a failing of our state and our state leaders, quite frankly. So those are the pieces that I think there's so many lessons learned, but I think the biggest one is that we can't be afraid of the attacks. And we obviously have started something that needs to keep going. And that's not because of the way the media is portraying it. It's because of what I see every day on the ground. It's because of the stories that I hear every day on the ground. Do we need to figure some things out and make sure that we can create better partners in the community to make sure that we don't have a lot of people using on the streets? Yes, but we also have to give them the tools that they need to be able to not have to use on our streets. And we need to have a better conversation that is centered in human compassion and really public health. So I think that's all I want to say, because I really love doing Q&A on this issue.
So Morgan, do you want to just jump in and talk a little bit about Portugal, and then I'll talk about what else is happening across the country? I think folks probably saw there were a couple articles out there about Portugal, which for those listening in, Portugal was really the first model of decriminalization, had incredible outcomes that were evaluated and researched over now almost 2 decades. And so, but we just want to give a little brief update on Portugal. Morgan will do that, and then I'll be back.
So last summer in 2022, I went to Portugal for 2 weeks to study their system of drug decriminalization, having already been involved with Oregon's process for about 18 months at that point, and it was very enlightening. So I just want to back up the 3 different ways that Portugal has been used for and against us, because it keeps changing. If you would have asked people who support the drug war in 2020 if they would adopt a Portuguese-style model of drug decriminalization, seeing how successful Portugal would have been, I'm not sure what they would have said. I don't think they would have been like, yes, let's decriminalize drugs exactly like Portugal did. But then Measure 110 passed. Various groups would make comparisons between Oregon and Portugal. And then you saw this narrative that like Measure 110 isn't enough like Portugal's. It doesn't go far enough to be like Portugal's. which was interesting coming from people who literally support the war on drugs and would not have ever endorsed the Portuguese model. But I thought that was, and then you'll hear sometimes that the Portuguese model endorsed like a coercive treatment. And so that was like the first thing that I studied when I got to Portugal. I got on the ground, I speak Portuguese. And so I was able to embed myself with drug users. They handled their heroin problems so well, I couldn't find any heroin users, but crack was on the rise. And I heard that last summer, and that's about to come back into the narrative just in a second. And I was talking to drug users. None of them had been sent to the dissuasion committee. They said as long as they were honest with police officers about the quantity of drugs that they had, that it was okay. But every single one of them knew exactly where and when to access services. And that blew my mind. But they were not afraid of police officers. In fact, they saw police officers as either neutral or mildly benevolent. And having been a drug user in the United States, that just, again, shocked me. Portugal was lauded as this like international success for their implementation of drug decriminalization since 2001. And last year, the critique was that Oregon isn't enough like Portugal. But now, starting a couple months ago, this has shifted. So you suddenly saw that some people in Portugal are now 20 some years later upset with their drug decriminalization. Why? Well, they're having a housing crisis, very similar to Portland's, actually. Their real estate values have increased on par to that of Portland's. So what has that produced? An increase in homelessness without financial security. They're also seeing small, much less than the United States, but increases in petty crimes. And similar to what we see in Oregon, you're seeing this convergence of other social factors in Portugal, and people, well, they can't really fix the housing crisis, right? They can't provide people an economic security, but they can recriminalize drugs, or at least they can claim that they want to. And so you're seeing a small faction of Portuguese people saying, drug decriminalization is a failure. Well, it was it's 22 years later, and all the data shows that it was very successful. They still have some of the lowest drug use rates in Europe, very low rates of overdose, very low rates of HIV. But it is this connection between any social ill that is visible to passersby and drug decriminalization. And so that's where we're sort of seeing a link again between Portugal and Oregon, because people are becoming frustrated with homelessness or whatever they're seeing on the street and pinning that on drug decriminalization in Portugal. Now, the Portuguese model is very sound, right? It has been in effect for 22 years, and I do not think it is going anywhere. I didn't hear anything about this when I was literally studying decriminalization in Portugal last year. But, you know, when the media descends on a place, you can always find opponents that will give you quotes, juicy quotes for your story. So I think that's more what's happening in Portugal. But yeah, we have a fraying of the social fabric fairly internationally across Western nations, rising economic insecurity, and incredible housing unaffordability. And that is manifesting in people becoming frustrated, and they tend to find the nearest scapegoat, which in this case is drug decriminalization.
Great. Thanks, Morgan. I just also add that Portugal also decreased their funding into their behavioral health system, which also we know, and what lessons learned is that you can't just decriminalize, you have to invest significantly in your addiction services and behavioral health services system. And then just briefly before we go to Q&A, I just want to stress that there is great interest in a health approach to drug possession and use across the country. There are various legislative campaigns happening right now, New York, Vermont, Washington, D.C. There are other states that are ballot initiative states that are looking into putting a health-focused approach to drugs on their ballot. Lots of states, there are lots of allies in various states that are looking and pushing legislation, Massachusetts, Minnesota, New Jersey, Rhode Island, Maine, to just name a few. We being Drug Policy Alliance have a very robust, exciting group of individuals from all across the country, which we convene quarterly to have conversations about decriminalization, to learn from each other, to build the movement. And if anyone is interested on this call and learning more about that national decrim table, please reach out to me. I'll put my contact information in the chat. But it's also bigger than just people focused on drug use. It's really bringing together movement leaders to decriminalize people, right? So we see things around poverty, around sex work. So other behaviors, conditions, and identities that we see are under attack. And so there's really an exciting movement that's building around this idea of a health approach to various issues in our local communities, and also the importance of building partnerships with advocates around housing, homelessness, economic justice. The most exciting thing, I think, well, not the most, but one in Oregon, is seeing how the funds going to actual housing, right? And we forget that we have to redefine what we mean by treatment. It's not just a bed, it's not just outpatient treatment, it's housing, it's food security, it's child welfare issues. And so that's the exciting thing, I think, also about the Oregon model, is that it's broader. So with that, thank you so much. And Monica, we'll pass it back to you for Q&A.
Sure. And I'm again,
Question.
go ahead.
Sorry, I just wanted to start with Heather's question because it'll be fast.
Sure.
So Heather wants to know about that 95% residency number, and am I answering? I don't know if that's working. I clicked the button. So there's several different research projects, one of which I'm involved on, where they're interviewing like 800 different Oregonians. And that's a question we've asked. It's like, do you live here and how long have you lived here? So when those results come out, we'll really know, like currently the average is people have lived in Oregon for like 33 years or something, you know, like we're not seeing very many recent transplants, but that is still preliminary data. But just to speak to Tera's point, while I was interviewing some of those people at a place in Eugene, I was at a peer drop-in center funded by Measure 110, and the Eugene Police Department brought a guy in need of services voluntarily of his own volition to get connected with housing and harm reduction. And I have never seen that in all my life. They let him, he was uncuffed in the back of the cruiser, and they let him and his dog out of the back seat and like introduced him to the peer. And so that is like a police officer who made themselves aware of Measure 110 funded services. And now instead of arresting people is acting as a connection to services. So I just thought that was really cool. And we'll be done collecting that data in about 6 months and really see just how many people are lifelong Oregonians.
Thank you so much, Morgan. I want to start. And again, you know, everyone, please use the Q&A for questions to the audience. We'll try to get through as many as we can through through the rest of the time. So I want to start with Doug, because he mentions his question. He talks about sort of the state of Oregon's legal system being in crisis. I'm just going to read what he shared because he cites a report from the Oregonian. I'm not sure if I'm pronouncing that right. My apologies. On Tuesday, that cites over 2,500 defendants across the state are stranded without lawyers. And so his question is, what impact would recriminalizing simple possession, as some prosecutors and police are calling for, have on Oregon's criminal legal system? And anyone who wants to take that first.
I mean, I can say just kind of from our perspective, especially in Hi Doug, what, you know, a lot of the folks who work with us every day are also working on the public defense crisis in Oregon, and it is an absolute crisis. And I think that it's really important when there are people coming after this policy, they are not able to go much deeper than we just need accountability. Until when you ask, well, if you're going to recriminalize folks, isn't that going to take a whole lot more resources, especially when it comes to the public defense that we don't have? That being said, this is political. This is not a policy. This is not a policy discussion that is happening in Oregon, at least at that level. This is a political grandstanding opportunity for some folks, and they are not interested in the real solutions. And I can say that with a full straight face because nobody has talked to us or any of our providers about their concerns and how they think accountability could work. And none of this is realistic. We don't have enough treatment beds, even if it was a good idea to mandate people to services. We have at least a 2,000 to 3,000 wait list for our current detox in Portland. That means that we would take all of those folks off the list and just make sure that the people who aren't even asking for the services are going forward. And that would be assuming that we had enough public defense to represent them to even get them there. So the argument falls apart really quick, but unfortunately, people and voters are very frustrated by what's happening. And the opposition is really painting this picture that we just need to hold folks accountable. We don't have systems to hold people accountable. And that's exactly what Doug is talking about with the Oregonian article.
Current felonies. The Multnomah County District Attorney's Office has to keep a dashboard updated every day of how many serious felonies have been dismissed for lack of representation, because there just are not public defenders, not enough, especially in the Tri-County area. But like Tara said, that doesn't quite matter. We're not really arguing on like logical fact-based or evidence-based approaches.
Thank you. I want to pose another question from the audience that comes from Charlotte. And I think it's sort of, and I think some of you may have touched on this, but if you could go back a little, expand more. But our question is, what has been the most effective arguments to counter the rise on crime narrative?
I mean, I think that this is, again, the conversation, the problematic conversation we're in is that Morgan showed data. We have new data that shows that drug crimes haven't gone up in Oregon. And that is not what people are experiencing on the streets, and that's not what they're seeing in local media. And so because of that, they're looking for a silver bullet, a thing to blame, and the opposition has really handed them a silver platter, which is it's Measure 110. And that's the thing that they're remembering changed. And like we talked about earlier, the pandemic happened, period. And everything that fell out from a global pandemic and a shutdown is what we're experiencing. So I think it's really difficult to have this conversation because we are trying to make sure that we're not being dismissive of people's experiences, because people are experiencing more crime. At least it's more visible. That is not because someone is able to have a gram of heroin in their pocket and not go to jail. That's not the reason. So, we're still in the battle of trying to really detangle all of these things.
Yeah, and like Tara said, Oregon's overdose rate is in the bottom third nationally, meaning 2/3 of US states have a higher, but it's one of those things where facts, I can show you the graph with the different states and all their overdose rates, and I can give you the facts, and I can tell you that 95% of citations went to Oregon residents, and I can show you that actually no, Washington state's overdose rate increased more than Oregon's did, and they didn't decriminalize drugs. But these facts do not sway people. Facts are insufficient. I'm actually speaking on a panel about this for DPA, but yeah, so why do facts fall short? And so I've been really trying to work on storytelling. I have friends who were living off of boosting and clacking windows, and they are now housed through Measure 110 funded services and are working jobs and are no longer committing crimes. And so data can't really fight that rise on crime narrative, but I think maybe stories can.
And just like a follow-up to this conversation is that where we find ourselves is constantly having to correct media after they've published a story. I can't tell you how many times we've sent correction notices about crime and about overdose deaths. And the latest one is about whether or not you have a legal right to smoke meth on the streets. That comes out, people consume it, and then we're the ones having to be like, actually, that's not right. Doesn't matter anymore. Right. And so that is the frustration. And if you're in a state that, like, these are the things that we're grappling with, and I don't want to sugarcoat it. It's really hard. And it's really, and you can see, I think especially me and Morgan are pretty emotional about this because we're just getting beaten down from these narratives. And it's really hard to tell the stories of Morgan's friends and the folks that we're hearing without being able to, really push those out in a meaningful way. We're collecting them. We have incredible story banks. We have incredible things to say. But it takes a lot to get those out into the community for it to saturate.
Is there any evidence of sabotage or a lack of implementation by law enforcement, or collaboration by law enforcement to help Measure 1 succeed? So either direction, positive or negative influence. I think in RTI did a research project on this. We know that law enforcement, by and large, do not support drug decriminalization. And Tera, I don't know if there's anything you want to speak to the sabotage question's a little delicate.
I think that I like to approach everything with best intentions and assuming best intentions and good intent. I don't blame law enforcement necessarily as a whole because our state failed them. Our state leadership failed them in getting them the tools and the information they needed to be successful to do this. That was sabotage. Whether or not law enforcement is intentionally doing one thing or another, I think law enforcement is extremely frustrated that they don't know that there are resources out there and they don't know how to connect to them. And they are used to unfunded mandates that we come up with, and that when they hand somebody something, they're assuming that there's nothing on the other end. We're working closely with the Portland Police, a few folks in the Portland Police right now to set, and a handful of our local providers to set up kind of an informal pilot project to try and connect folks, the patrol people on the ground, with our people on the ground to really make sure that that they know what's out there. People didn't even know that we had 41 providers in Multnomah County, which is Portland, funded, and that they have a lot more outreach and drop-in centers and other things that could support law enforcement. And Morgan's story about Eugene is what we're trying to replicate and trying to bring a little bit more to Portland. And because we're in this political kind of fire, you got to kind of just work on relationships and making sure that the law enforcement that do want to be able to help and to be able to connect folks know what's happening. I've invited them to this opening of this detox center tomorrow because this is going to be a resource for them, not just for them, but it is a resource in our community that we didn't have before. So I'm still operating on good intent. We don't have a uniform citation that the Justice Department has actually issued. So every law enforcement agency had to create their own. We had to do some like business card saying, here's the phone number to call, that law enforcement didn't even know how it showed up. They called me yesterday to ask how to get more of those cards. It has not been implemented. And that is the executive branch's job. So it's really hard to decide, like, why is this happening? Other than I've been pushing really hard. We do have a senator who is pulling together a citation work group so that we can hopefully get to the bottom of that part.
Yeah, I tried to become a police officer when I first got out of the military, and I wholeheartedly believe that. Because I know why I wanted to do it. These people want to serve the community, but so many of them just do not know how to connect people to services. They do not know what is available. And that is a failure on our part, not theirs.
I see Chris's, I don't know if you were just looking at that, Morgan, question around the 13th step.
Yeah, I just binged this podcast. So
that's good, I haven't.
Yeah, so it is true. Sexual abuse is rampant, and it is particularly vulnerable for people in total institutions, right, who have a lack of autonomy and bodily autonomy and empowerment. Measure 110 funded low barrier services, outpatient wraparound, different things, but not that total institution setting. There isn't the greatest data on that, because once you come out of a total institution, all the stressors of your life are just there waiting for you. They were on pause the day you walked in, and then you walked out to the same thing. And so we have various reporting mechanisms and oversight for any grantor that took our money. We have very strict values that we adhere to. I haven't yet heard of any specific on this, but this Measure 110 funds are the most value-based government funding program I have ever seen. And so any issue, there were some minor scandals in the grants process for perhaps some people that did not actually embody all of the Measure 110 values, and they did not end up getting money. And this is a constant conversation on the Oversight and Accountability Council, making sure that the people who accepted our funds are doing what they said they were going to do in adherence to our values continuously. And one of that would also include doing no harm in their community of any type.
Awesome. Thank you, Morgan, Emily, and Tara. And I like what Morgan said in terms of, in responding to one of the questions, why do facts fall short? I feel like that's a good segue into the last panel, which is really going to be talking about communications and messaging and sort of narrative building around criminal legal system reform. So if you are interested in that, please join us for this last panel of the day. But again, thank you to our panelists.